Patients often ask us what is the name of the test for female fertility. Well, it's usually a group of tests and it's usually called the female infertility profile. This includes a series of blood tests, some urine tests, and also some radiological scans which include the ultrasound and the X-ray. So it's a panel of tests, it's a group of tests all put together. They are called the female infertility profile. But if you just want to go in for blood tests for female fertility, in some labs and clinics, they only do 3 blood tests, which is the FSH, the LH and the Prolactin test, and they consider this to be enough to assess your fertility. So if you want to go in for a low cost option, the name of the tests are FSH, LH and Prolactin blood tests. There are 3 blood tests. But if you want an extensive panel to check entirely all the things that are involved in your fertility, then you need the complete female infertility profile. I'm going to explain all this to you in this video. What will the female fertility panel actually check? So if you go in for just a simple fertility tests, which are the FSH, the LH and the Prolactin, which are just the 3 simple blood tests, they will check whether the brain is making the right amounts of fertility hormones. Out of these, the FSH and LH are the most important, and if your brain is not making enough of these hormones, your fertility will not be normal. So the FSH, LH and Prolactin check the first part, which is whether your brain is making the fertility hormones properly. The next, which include tests like the AMH, are the ones which are going to check whether your ovaries have enough eggs left in them for fertility. You know that during each of your menstrual cycles, 1 egg is released, and as you grow older, the number of eggs goes on reducing, which are still present in the ovaries. The ovaries are present on each side, 1 on each side, just below your stomach. So the tests like AMH will check whether there are still enough viable eggs present in your ovaries for fertility. Then we want to check whether you're metabolically okay. That means, is your sugar fine, is your cholesterol fine, because women who are obese or who have high blood sugar are usually not able to conceive as easily or as well as women whose sugar and cholesterol is normal. So the tests like HbA1c and also the cholesterol test will check for this. Next, we also want to check whether there is any blockage in your tubes which carry the eggs from your ovaries down to your uterus. These are called your fallopian tubes, and we need to be sure that these tubes are not blocked somewhere. Now to check this, you need the radiological scans, like there are certain X-rays that are done, a special type of X-ray, and we also need the ultrasound to check whether your ovaries are also, totally okay. They don't have any fluid in them, they are not filled up with some small spaces. All this we can check from the ultrasound, and also for this purpose to make sure that you don't have any STDs, because the STDs are sexually transmitted infections which can block your tubes. So this is what all these entire fertility profile panels check. As I told you, if you're only going in for the low cost option, which is the FSH, LH and Prolactin blood tests, then you're only going to get the first point out of this, which is the checking of the levels of the fertility hormones. But if you do the whole thing, then you can check all these things together. So here is an entire list of these fertility tests. I've included the complete list of all the hormones, all the STD tests, the metabolic tests, the X-ray or the ultrasound that I already explained. So to go over it quickly, the ultrasound and the X-rays will check whether ovaries are anatomically fine. That means they don't have anything wrong in their shape, size. There are no huge cysts or fluid inside that. We also use the same modality to check whether there is any blockage in your fallopian tubes, the tubes which carry your eggs from your ovaries down to your uterus. We check that. Then the STD tests include things like testing for Chlamydia and Gonorrhea. The metabolic test look for your sugar. So for this we do the HbA1c, which is your 3-month average of your sugar. We also do your lipid profile, which tells us your cholesterol. And then there's a long list of all the hormonal tests that are done. Each of these has their own importance. I've actually made separate videos on each of them. But by and large, what you have to understand is that each of them is important. For example, the testosterone test will tell us whether you have something like PCOD, where your testosterone level is too high. Because of that, you cannot conceive. So they all have their own roles. I've explained a little bit of this more in the subsequent slides. The ultrasound and the specialized X-ray tests are done to check whether your ovaries and your tubes are in normal shape, size and form. If there is a blockage in your tubes, your eggs will not be able to travel from your ovaries downwards. Because of this, you will not be able to conceive, and this can be checked by a specialized X-ray technique called hysterosalpingography, which is done only by radiologists. The next thing is the ultrasound scan. We do this to check whether there are fluid-filled spaces inside your ovaries. These are called cysts. If you have too many of these cysts in your ovaries and if they are of a very large size, this is called something called polycystic ovarian syndrome, which is usually a very bad sign if you want to get pregnant. Women with PCOS have a hard time getting pregnant, and the ultrasound helps us to know this together with some blood tests which are included in the list of hormones. So this is what you need to get done from your radiologist. I've also included now all the other blood tests that you need to do, which are maybe equally or more important. So what do the hormone tests help us to know? These are all blood tests. You have to do them on the 3rd day of your menstrual cycle. Do not do them on any other day. The results will not make any sense. What they tell us is whether your brain is making enough of the fertility hormones, that is the FSH and the LH. If there is something wrong in your brain, in the organ in your brain called the pituitary gland, this will not make enough of the fertility hormones and you will not be able to conceive. The next thing that is we want to know is whether your ovaries still have enough eggs. So the tests like the LH as well as the AMH will help us to know this. Both of them help us to know, together with the others, they help us to know whether you have enough viable eggs in your ovaries. Then there is the testosterone and the DHEA-S test, which tells us whether you have too many high levels of male hormones in your blood. Having high levels of male hormones affects your fertility. You are not able to conceive, and this is actually called PCOS. Together with this, we also check your thyroid level, because if your thyroid is not working properly, you will not be able to conceive. Lastly, we also look for the prolactin test. The prolactin is a hormone which is also made by the same thing in your brain, but prolactin should be less than 20 or 25 for you to conceive normally. If the prolactin level becomes too high, you cannot conceive, and that's why all these hormones are tested for in the blood test. It is recommended that you do all these hormones, because just doing the FSH, LH and prolactin may not be enough for the doctor to make up their mind about what is wrong with you. The metabolic tests, you might be already knowing about these. We just check for the level of sugar in your blood. We do the HbA1c test for this because it tells us the average sugar over the last 3 months. With this, we also check for your cholesterol. This tells us whether you're obese. A high cholesterol level is never a good sign for fertility. So we check for cholesterol and sugar. The metabolic tests, you might be already knowing about these. We just check for the level of sugar in your blood. Lastly, we also check for the STD tests. These are done on the urine sample. They tell us whether you are currently carrying an STD, including Chlamydia or Gonorrhea. The reason why we do this is because this can block your tubes. It can cause a obstruction in your tubes, which will prevent your eggs from reaching down below, and you just won't be able to conceive. So they are very important to get done, also for the safety of your partner. Lastly, we also check for the STD test.